This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. During the next hour, John Van Camp, who's sitting in for Daryl Wayne, the insane Daryl Wayne, we're going to be talking about some things that touch each and every one of us. We're going to talk about growing old and what that means. We'll get John's opinion and thoughts on that during the second part of our show. Joining us now from Kalamazoo, Michigan, is a young man who really is a hero in the healthcare arena. And I mean that quite literally. We'll find out more about that. And Kalamazoo, I understand Nick McLaughlin is where kazoos were made first, maybe?
Yes, sir. Yeah, and it's also the only zoo in the United States that has the small brown rodent called the calama.
Okay, and you're a native.
That's right.
And wow. Okay. Really, kazoos were made there first? That's
no, and the thing about the calama at the zoo is also false. There's no zoo in Kalamazoo.
Oh, okay. I wasn't sure about that. We have a zoo not far from me in Santa Barbara, and they have the world's largest rodent. I mean, it's like as big as an elephant.
I apologize. I'll leave the jokes to you, Mark.
No, I think your jokes are probably better. We better get serious. Nick is the CEO and founder of Breez Health, and you can go to breezhealth.com to find out more about them. Here's an interesting statistic. 60% of patients avoid medical care because they can't afford it. Is that including people, Nick, that have insurance?
Yeah, it really is, Mark. And I mean, just think about an elderly couple that's on Medicare and Social Security. I mean, we hear stories all the time about folks like that are really just pinching every penny and often cutting pills and not taking their prescriptions as they're supposed to and not filling them when it's time because they are afraid of the cost. And it's not too much to say that we do have a healthcare affordability crisis in our country.
What doesn't make sense to me, and never has, is that you have health insurance, okay, and even prescription insurance. I personally don't need help, and I'm being transparent here. I don't need help with a prescription that costs $10, and I get that with my healthcare insurance, or $50. I could even struggle to pay $100 a month for a prescription. But when they're $10,000 a month, it'd wipe me out. And I think it would wipe out most people.
Yeah, certainly. And drug pricing is one piece. Our specific arena is partnering with hospitals to help make their services and hospital bills more affordable to the patients that need it the most. Our whole mission is making financial assistance easy for patients and for hospitals. And so, yeah, it's really our focus is on the hospital side of things, less so the prescription side of things. But your point is still very valid.
But it's the same thing. Somebody goes to the doctor. He says, "Oh, you needed surgery. It's not a big deal, but we just want you to know that your insurance or Medicare will cover only part of it." And you end up in debt because you have to go several times for whatever treatment it might be at the hospital. And, you know, you'd have a $250,000, $300,000 bill above what the insurance is willing to pay for.
Well, and I've spent a lot of time in the healthcare finance and revenue cycle world, specifically on the patient billing side of things. And one thing that I saw happening a lot was patients in this kind of early career or fixed income, folks in that kind of lower income working class area that there are resources available for them. Specifically at nonprofit hospitals, they're called financial assistance policies or charity care programs. And in my world in my working with patient billing and hospital billing, I saw a lot of patients winding up in collections that would have qualified for financial assistance at their hospital. And so after helping a few friends and family members apply for financial assistance at their hospitals and health systems, I really wanted to make a better way, an easier way for patients across the country to access that, because just helping onesie twosie people that I know isn't really a scalable way to help make healthcare more affordable.
But you have made it scalable, and healthcare nonprofits throughout the country can take advantage of this. It helps them, and more importantly, it helps the patient. Your background is interesting because you were the guy who called up and said, "Mr. Smith, we know you had an operation. You owe us $182,000.05."
Yes, sir, I was.
Right? Your parents weren't happy with that. Tell us about that.
Yeah, sure. Well, I grew up, my mother was a nurse and my father was a scientist, and they both taught me how important people are and caring for people no matter what their situation. And when they found out that I went to work for a collection agency that partners with hospitals when I was in college, they about disowned me. They said, "Nick, what are you doing calling up sick people and asking for money?" And I tell you what, that was an incredible experience. I saw the good, the bad, and the ugly in that world. And one thing that I'm really excited to be bringing to the hospital market right now is an opportunity to link arms with the hospital leaders that are leading the charge from a financial assistance perspective, that truly care about making their care, or making patient care affordable for patients, and essentially being the engine behind the hospital's financial assistance policy that makes it easier for patients, but also easier for the hospital.
A couple of years ago, Time Magazine did an in-depth article and research. And they picked a hospital. I believe it was a nonprofit. It was connected with the University of Texas, and they broke down a hospital stay. And to me, staying at a Ritz-Carlton at $500 a night, I think you're going to get better care than you do in a lot of hospitals, because they're understaffed. The nurses are overworked. We've been doing some shows on nursing in the past, and probably should do some more. But it's a crime. The number I'm remembering is for an aspirin in a hospital, a generic aspirin or a Tylenol pill was like $10. That's absurd.
So I'm not familiar with all of the intricacies that go into hospital pricing, as you can imagine. I'm sure that there are a number of factors that go into play for that. Yeah, it's really easy to point at that number and say there's no way that could be justifiable. And that may be the case. And there may be some significant opportunities for reform in those spaces. When in the context of healthcare affordability, affordability is a relative statistic. It's not just a price in a list. And what we're excited to be working on is helping make healthcare more affordable for the people, the patients that really need it the most. I mean, the patients that have that are really well off and have extra money, I think it's okay to ask them to pay their portion of their hospital bill. But our goal is to help relieve the financial burden on the patients that really struggle the most with their healthcare bills.
Our guest is the CEO from Breez Health. Check them out at breezhealth.com. We'll have some information about Breez Health on our website, latenighthealth.com. Even a pretty picture of the young Nick McLaughlin, who is spending his life now paying it forward. And I think that's really great. I think he's a healthcare hero. We're going to take some time out. We'll find out how this works, what you can do if you need help with paying hospital bills, and if you're at a hospital that can take advantage of Breez Health. I'm Mark Alyn, along with John Bandcamp, sitting in for the insane Daryl Wayne. Don't go away. Much more coming up with Nick, John, and me. I'm Mark. Recently, I met Jacqueline from Bright here in Los Angeles. She gave me a hearing exam and then showed me how to hear again with the new Signia Pure Series hearing aids, and she can give you your life back too. I hear birds chirping, birds cooing, and even my wife. They easily connect to my smartphone. The Signia hearing aids are amazing, and with the charge and go, I don't have to fiddle with batteries and hear all day long. Not hearing is frustrating for you and your family. I know you don't have a problem, but trust me, call Bright Here now for a free hearing exam, a $125 value, yours free, just for making an appointment now. There are offices throughout the Los Angeles area. Call Bright Here now at 323-424-7100. That's 323-424-7100 for a free hearing exam. There's no obligation. Call now, 323-424-7100, or visit them on the web at brighthere.com.
If you're listening to Late Night Health right now, you're part of the growing target of baby boomers we're serving. Hi, I'm Daryl Wayne, producer of Late Night Health, inviting you to join the Late Night Health family. If you have any business targeting the growing boomer market, Late Night Health is the ideal advertising vehicle for you. From vitamins to insurance, alternative health to Western-style medicine, Late Night Health caters to the growing population of those over 40 years old. This vibrant demographic has expendable income to fight aging, purchase travel, take care of aging parents, or just have fun. Find out about the advertising opportunities with Late Night Health. Call us at 805-391-0308. That's 805-391-0308, or email us at info@latenighthealth.com. That's info@latenighthealth.com. Join Late Night Health as we empower people to take charge of their own health care. Call now at 805-391-0308. That's 805-391-0308.
Role models. They can make all the difference. In our world today, they have never been more important. One of the nation's most successful mentoring organizations is Jewish Big Brothers Big Sisters of Los Angeles. Their mission is to assist youth in achieving their full potential through innovative and impactful programs. And no nonprofit agency does it better. Jewish Big Brothers Big Sisters of LA serves Jewish children, boys and girls in our local community with a mentoring program that's been going strong since 1915. That's only the beginning. This nationally known agency owns and operates Camp Bob Waldorf. Its summer camping and weekend retreat programs enrich the lives of youth throughout Greater Los Angeles. Then there's a college support program, and last but not least, work that helps kids all over the world through the Teen Talk app. Want to learn more? Go to jbbbsla.org. Donate. Get involved. There's no better way to make a difference.
Sometimes it's not what you say, it's how you say it. Words are a critical aspect of success. How you get your point across is a crucial part of what makes anything sell. So do it right and hire a writer. Whether it's articles, blog posts, technical writings, website content, product descriptions, or ghostwriting anything from a novel to a nonfiction book about your navel, contact Servet Hassan. If you want it to sell, write it right. Email Servet at servet@servethassan.com.
There's a lot of talk all over the internet about the remarkable benefits of Carbon 60, and baby boomers are especially excited about it. Greska's Carbon 60 is the premium Carbon 60, developed by an aerospace and NASA scientist. 95% of Greska's customers report positive results from this Nobel Prize-winning technology in just 4 days. Imagine more energy, better health, and more vitality. It's very bioavailable to quickly mend toxin-crippled cells. This is a super powerful antioxidant. Bob Greska is so confident that you'll love his Carbon 60, he wants to send you a bottle at 50% off the regular price to see how life-changing this will be for you. Call 720-600-6040. That's 720-600-6040. Visit c-60.com to learn more. Call 720-600-6040 now or visit c-60.com. Late Night Health continues. I'm Mark Alyn, along with the vacationing insane Daryl Wayne's sit-in, and that's John Van Camp. And we appreciate, John, your taking over the helm. Our guest is Nick McLaughlin. He's the CEO and founder of Breez Health. Healthcare is just out of sight in terms of financial costs. We're one of the most expensive healthcare systems in the world. I don't think it needs to be that. The Affordable Care Act has come into play, the Obamacare. I've said on this show numerous times, I think it's a step in the right direction. Is it perfect? No. But it is a step in the right direction, allowing people who couldn't afford insurance to be able to have it. I think insurance needs to go further. It says healthcare on your policy, everything's covered. That's what I believe. But probably some lawyers got to be paid a lot of money and have exclusions to that. Nick, with Breez Health, what kind of savings can somebody expect? And you have a story, a personal story.
Yeah, certainly. So a little known part of the Affordable Care Act is a provision that requires nonprofit hospitals and health systems to offer these financial assistance programs that we've been talking about, according to specific income eligibility criteria or insurance, whether or not patients have insurance or not. And these programs offer financial assistance to patients, oftentimes up to 400% of the federal poverty level. But what the heck does 400% of the federal poverty level mean? Well, if you imagine an elderly couple, let's say they're on a fixed income, they could be receiving income from Social Security and their retirement up to $73,000 per year and still likely qualify for a financial assistance discount on their hospital bills.
Is that a combined income?
It is family income. So the main mark for whether or not a patient qualifies for this is household size and family income. Those are the two factors that go into federal poverty level percentage. And so that's a family of two. If we're talking about a family of five, 400% of the federal poverty level is about $130,000 a year in income. And so it's easy to imagine a young family, 3 kids at home, mom and dad both making $50,000 to $60,000 a year. It's likely that family qualifies for a discount on their hospital bills, even if they have insurance, between 50 and 80%. And you mentioned the personal story. So my sister and brother-in-law live in Chicago, and they were about to have their first baby. My sister was working an entry-level job. My brother-in-law was still finishing up school. And I said, hey guys, I know you probably got a big hospital bill coming up. I'd really encourage you to into financial assistance. Can I help you with that? Because that's a world that I've gotten to know very well over the last 12 or 13 years. And they said, sure. And so we looked into the financial assistance program, and they were able to get their $5,000 hospital bills reduced down to $1,000. And $1,000 is still a lot of money for baby bills, but it is a lot more affordable to put that on a payment plan than $5,000.
I have a friend, and I'm trying to think of who it was. When they had a baby, they actually got a check from the hospital for $100. I swear. But that was 25 years ago. And what they should have done is taken that and started a college fund, because who knows what that would have been worth today.
There you go. But I just want to add real quick, if you don't have gobs and gobs and gobs of money and a very high income, I would encourage you to look into financial assistance at your local nonprofit hospital, because the resources are available and the programs are grossly underutilized. And we really want to help make healthcare more affordable for patients, and hospitals do too.
I know somebody who walked away from hospital bills close to $200,000. He was in the hospital in ICU for, 6 weeks. And just, he walked away from it. Is that happening more and more? That people just, you can't know what you're going to pay in advance. You go in, you have surgery, there's complications. You could be in the hospital for 3 weeks when the doctor said you'd probably be out in 3 days.
Yeah, it's so hard to know what your hospital bills are going to be. And I don't know if the case of just letting the bills like actively walking away from the bills is something that happens all that particularly commonly. But what happens every day, all the time, is patients receiving bills that they can't afford, and they go on the stack. And what happens when the bills go on the stack for when they can get back to them or when they have the money to pay is they sit there, and the next thing you know, it's 4 to 6 months later, and the accounts go to collections, and the patients don't have the ability to pay those bills. And so accounts that could have qualified for financial assistance just go to collections and sit there forever and ding these patients' credits. And every once in a while, sometimes we'll go to attorneys for legal action, which is never something that hospitals really want to pursue. And so it's more of a passive accounts piling up in collections than it is actively leaving them behind.
Has the Affordable Care Act helped people pay those bills through that financial assistance program and through Breez Health?
So it's not so much helping them pay, it's just helping the hospitals help the patients that qualify for these programs, get them out of collections onto the financial assistance program, so they don't have to be afraid of getting massive hospital bills they can't afford. And honestly, so Kaiser Permanente and Stanford University, the economics department there, did a study on what happens when a health system expands or connects their patients to their financial assistance program. And they saw immediate and significant spikes in doctor's visits and prescription refills from these patients, which people don't go to the doctor unless they need to go to the doctor. And we want to remove the financial barrier of care and help patients seek care that they need.
It's really terrific. And I've got to ask this. I mean, I think this is, as I said earlier, you're paying it forward and you're helping people get the care they need and help them pay what they can afford. Would you agree that healthcare in this country is just out of control regarding the financial consideration? I mean, when you think of a pet, a dog or a cat going through chemotherapy, and that's 10, 15, 20 grand for a pet, God knows what that could cost for a person.
Yes, certainly. And I mean, our focus is very squarely on helping make it more affordable for the patients that need the help. We try to stay away from the specific pricing conversation because that's above our pay grade and expertise level. But making healthcare more affordable for the patients that need it is squarely in our wheelhouse and something we're excited to be working on in partnership with hospitals that offer this great care.
Nick, we really appreciate your time. I really think you're doing a great service. And as you expand and grow, will you keep us updated and let us know how you're doing and come back?
Yeah, certainly, Mark. My pleasure. You mentioned the website a couple times.
Yes.
breezhealth.com. So it's spelled just a little bit differently. We've only got 2 E's in Breez. So it's BREEZHEALTH.com. And we are a member of the Goodroot community of companies that who's working on reinventing healthcare one system at a time. Our broken system that we're working on is helping hospitals run their financial assistance programs better. So it's a pleasure to be here. Appreciate the opportunity.
Thank you, Nick. We really appreciate you. Again, visit us at latenighthealth.com. We'll have a pretty picture of Nick and some information about Breez Health and the website so that you can check it out. All right, coming up, John Van Camp, he gets in the hot seat. No, he doesn't. He and I are going to chat about growing old in these here United States, to take something from the Reader's Digest. I don't know. Anyway, we'll be back as Late Night Health continues.